Hello everyone, and welcome back to our channel. Today, we're diving into a topic that affects millions of people worldwide: gallbladder health and the role of bile in our bodies. Whether you've recently had your gallbladder removed or you're simply curious about maintaining optimal digestive function, you're in the right place. So sit back, relax, and let's explore the fascinating world of bile and its impact on our well-being. Gallbladder removal, also known as cholecystectomy, is a common surgical procedure where the gallbladder is removed. The gallbladder is a pear-shaped organ located just below the liver on the upper right side of the abdomen. While cholecystectomy is generally considered safe, some people may experience complications. These can include bile leak, leakage of bile from the surgical site, excessive bleeding during or after surgery, wound or internal infections, changes in digestion due to the absence of the gallbladder, jaundice, yellowing of the skin and eyes due to bile flow disruption. Contrary to the misconception that the gallbladder is unnecessary, it plays a vital role. The gallbladder acts as an extension of the liver. When you eat, it contracts and releases concentrated bile into the small intestine. Bile helps break down fats into smaller particles, aiding in digestion. Up to 40% of individuals who undergo gallbladder removal surgery experience persisting complications such as constipation, diarrhea, anal leakage, and discomfort under the right rib cage. This can lead to symptoms like a full sensation beneath the right rib cage or discomfort. Bile is essential for extracting fat-soluble vitamins D, E, K1, K2, and essential fatty acids omega-3 and omega-6 from the diet. Without sufficient bile, the body cannot absorb these nutrients effectively. Gallstones are essentially superconcentrated cholesterol formations. Insufficient bile production can lead to cholesterol becoming overly concentrated, contributing to the formation of gallstones. Taking bile salts after meals can aid in dissolving gallstones by helping to keep cholesterol from becoming overly concentrated. This prompts the liver to produce more bile, which can prevent the formation of gallstones. The body produces approximately 75% of its cholesterol internally, with only 25% coming from dietary sources. This highlights the significance of internal processes, including bile production, in cholesterol metabolism and gallstone formation. Estrogen, whether from birth control pills or pregnancy, can contribute to bile deficiency. This is why women, who generally have higher levels of estrogen, are more prone to gallstone formation. Prazosin, used for various medical conditions and liver diseases such as fatty liver, cirrhosis, or hepatitis, can also affect bile production and increase the risk of gallstones. High-carbohydrate diets and low-fat diets can disrupt bile production and increase the likelihood of developing gallstones. Overweight individuals with higher fasting insulin levels are also at risk. Deficiencies in folate, magnesium, vitamin C, calcium, and melatonin can impair bile production and increase the risk of gallstones. Gentle acupressure on the opposite side of the gallbladder, targeting the pancreas, can aid in digestion. The color and consistency of stool can indicate bile deficiency or excess. Gray or pale stools suggest a need for more bile, while floating stools indicate insufficient bile breakdown of fats. Bile salts can be taken as a supplement to aid in digestion, but dosage should be adjusted based on symptoms. If diarrhea occurs after supplementation, it might indicate excess bile and the need for alternative treatments. Milk thistle, beets, dandelion greens, and artichokes can help stimulate bile production. A diet that includes low carbohydrates, moderate fat, moderate protein, and daily consumption of salads can support bile production and overall digestive health. If bile salts worsen symptoms or don't provide relief, it may indicate a need for hydrochloric acid supplementation to support stomach acid levels. Adequate sleep in a dark environment, exposure to infrared light, and incorporating activities like spending time outdoors or near a fireplace can help increase melatonin levels, which in turn supports bile production. If you have a cholesterol problem, it could just be a gallbladder issue or a liver problem because you're not making enough bile. Bile is also made by your microbes, and so that's called secondary bile. Bile salts also help get rid of microbes in the small intestine, so in other words, we don't want a lot of microbes in the small intestine, so the bile that's dumped into the small intestine kind of clears out the microbes in the small intestine. Besides surgery, there are other options to consider. Lithotripsy's non-surgical approach uses sound waves to break up gallstones. Some people explore dietary changes, lifestyle modifications, and herbal remedies to manage gallstone symptoms. Remember that each person's situation is unique, and decisions regarding gallbladder removal should be made in consultation with a healthcare professional. Being well-informed empowers individuals to make the best choices for their health. Thank you all for tuning in today. If you found this video helpful or informative, don't forget to give it a thumbs up and subscribe to our channel for more content like this. Until next time, take care and stay healthy.